the most riskiest in terms of HIV. So the conversation will be, even most of these things being talked, most youth who involve themselves are on private organization, community and stuff. But the Ministry of Health has never really given that space to partner with the young people and say, those youths who are doing advocacy in matters of health, we are working together to empower you to continue with the advocacy, and even when they're coming up with policies on, now that we have this gap, how are the youth going to fit in? But rather, the ministry is always waiting for them to react when a problem comes, which is a very bad way of leading a very important sector like health.
Okay.
We can't wait until when the young people are dying every day, then the ministry says, we want a seat with the youth. Okay. No, we refuse that. We want the ministry to create a space whereby they will be involving the youth in advocacy, in policy, and also even sometimes financing such youth who are doing peer education in primary school, high school, universities, because not all universities are capable to do that. The University of Nairobi does it every semester, like big 1 week for advocacy, but then the students within can be able to talk to other students, those who are passionate. But not all universities are capable to do that. We also have so many young people in rural areas. What happens to them if the Ministry of Health is just assuming that, oh, these things happen in schools? There are so many young people who are not in university and colleges, and they also need to be, get training and advice about sustainability. And as I conclude on this, I will say, we have matters of harm reduction. Harm reduction will easily work for us as the youngest population in the country. And that still needs very big will from the ministry. Okay. Because it's so funny, other ministries which are not important, they have goodwill to work with the youth and ensure things work around. But ministries which are the backbone of our life, which is health, they tend to always do things shutting down the young people. And it is a problem that I think it has happened from the onset of the independence of our country. But now we talk and say, time is up. Time is up for the ministry to work with the young people.
Have you reached out?
And
are there openings to reach?
So we were doing harm reduction last year, mid of last year, but it was basically harm reduction of drugs, because if you know, there was this drug that young people were taking in the coastal region, and then they will, someone will just be stuck for, in a unmovable state for an hour or two. So we were trying to tell the ministry, can you put more effort and energy to find out, first of all, which kind of, drug is this? And then second of all, to educate the young people, the effect, and if they're addicted, for example, for tobacco, people can use vape instead of cigar. But then these are new things that we don't know. The ministry said nothing. And of course, I don't want to say much, but you remember that lady who went to face the CS? What happened to her?
Interesting.
Yeah.
Well,
so
what happened to her?